pre-employment exam for the CRC course, and you know, when I took mine, it was pretty easy compared to what is out there now, but that was a long time ago. They just want to know if you could do ICD-10, diagnosis coding. Really, they're much more in depth now. So we also kind of want to cover just quickly, this will help you understand what the employer is looking for. So jumping right in, and again, this will kind of help you with the thought process. Now, I'm not pulling out a ICD-10 manual, and so this would be these pre-employment exams are usually sent to you via a link, an email, and then they give you so many hours, like 24 hours, to complete it and send it back. Okay.
Alicia, can you hit that just below the share button, that little up arrow, so that it closes a little bit of those tools?
Let me get that, and this one too. Yes.
Mm-hmm.
Okay. I
So
think I got it.
Bigger for everybody. Perfect.
Oh, it's still loading. That's why it's.
Okay.
There we go. Okay. Still. Again, I'm not on my normal computer. I switched from an HP to a Mac, and boy, do I miss it. Okay. So, a pre-employment exam question, again, is predominantly going to be diagnosis coding. All right, they're not going to test you on STAR and all that other stuff. That's not what the unlike the practice CRC exam, they are going to test you on all that stuff. All right, simple statement: CKD stage requiring dialysis AV fistula patent. Okay, or patent. So this is what you need to know. You break this down really quickly. These are and again, these are things that you need to have memorized. And I'm really good about telling you, that you just need to be aware of this, or this is what you need to have memorized. If you're at this point where you're taking a CRC pre-employment exam, then you need to have this stuff memorized. You need to know CKD is chronic kidney disease, that there is more than one stage of CKD, 1 through 5. Dialysis is treatment for CKD. AV is arteriovenous. A fistula is an access point, and so when you see AV fistula, that means that they have been set up to get dialysis. It's literally where they plug you in to get your dialysis. Patent just means that that's how they're saying that everything's fine with the fistula, usually in the arm, and that it's stable. It's open and unobstructed is the definition, but again, that it looks good. You have to know that. Okay, memorized. And again, you probably do. But let's break down some differences between stage 4 CKD and stage 5 CKD. You need to be aware of, now you don't need to know the numbers and the lab work and stuff that differentiates between 4 and 5. You just need to know that there is lab work and numbers that will take you from stage 4 CKD to stage 5. It's you're not a clinician, you're not a provider, you don't have to have that memorized. You just need to know that there's the difference. CKD 4 is, you've really got a problem with the reduced kidney function. It's classified as severely reduced. And then CKD 5, very severely reduced, and again, oh, okay, that's so similar, but stage 5 is a little different because it ends up, you're going to see end stage or ESRF or ESRD, end stage renal disease. Okay, that is going to pop up and be a part of stage 5. We're moving into end-stage renal disease if we're not already there. So be aware of that. 1 through 4, yeah, that's compromise the kidney function. By the time you get to 5, you're looking at ESRD, And also, the reason you need to know this is because you need to understand the disease process. With risk adjustment, you're looking at a year's worth of documentation. So if you're working with a person that starts the year out with CKD4, then their lab works and they're changing, they're diagnosed with 5, and then you can probably expect, hey, we've got end-stage renal disease in the future, possibly this year. So again, you're constantly thinking the disease process. Okay. Again, you don't need to have these codes memorized. However, knowing that CKD5 is in 1.8.5, but there's an excludes with that, and this is where they can get you. Okay, you need to be aware that when you're dealing with CKD5, that if the CKD5 requires dialysis, it jumps, and now it's in 1.8.6. Okay, the codes change. Now, if you're not aware of that, then you're going to put down the wrong code, and then you're probably going to have the wrong HCC, etc., etc. So again, if you are coding then in 1.8.6, which is end-stage renal disease, because our CKD5 patient is on dialysis, then you also need to be aware of the Z code 99.2 for a status code for dialysis. Very important. So we're looking at what codes now. And again, Z99.2, dialysis, there's a whole list of status codes that you need to be very familiar with when you're doing risk adjustment course. In fact, we just talked about this on our call, Wednesday night student support call, on all of these status codes that are commonly overlooked that risk adjust. And Z99.2 is one. Okay, so you always want to be familiar with any type of excludes that go with that. I threw this in as well because if your patient is not just CKD, now this particular one isn't, that they may have hypertensive chronic kidney disease. That changes the coding, right? Because there's a causal relationship between hypertension and CKD. And this one isn't applicable for this scenario, but be aware of that. That's one of those things you need to have memorized. So again, I12.0 would be hypertensive CKD stage 5, and then again you would be doing the N18.5 or N18.6 if they were stage 5 chronic kidney disease, hypertensive, then and they were getting dialysis, it would be in 18.6, right? Because we were just told that a CKD5 on dialysis makes them an N18.6, which is ESRD. So the rationale that we give you with this particular scenario is that how you look up the codes, because you're looking them up from scratch, I like to say. So you're going to the index, unlike when you're testing, you know, you're not really going to the index, you're focusing on the tabular. They give you the choices. Practice exams, pre-employment exams, real world coding, you know, you live by the index and you always reference the tabular. So you're going to look under disease, kidney, chronic, stage 5, and but the tabular list includes the excludes 1. Now, under the N18.5, saying that you have to go to the N18.6 if they are on dialysis, and then the additional code is mentioned in there. Let's see, the way to find the Z99.2, dependence on renal dialysis, and so you look back at that and you say, well, don't I need to code for the fistula? You know, because that's the thing. You don't have to code for a fistula because they're on dialysis. And when you look at the description, it tells you Z99.2, dependence on renal dialysis, but the fistula was surgically created for dialysis. That's all put in there with that Z99.2. So don't be adding another code regarding the patient having a fistula. Very good. I think so. Very exciting stuff. Now, just wrapping up, I wanted to show you what those AV fistulas look like and where they're at in the arm, because if you have a patient, the documentation with an AV fistula, it's going to be mentioned most likely more than once, but definitely when he does a review of the body systems and stuff, it'll be mentioned, and that's a heads up. Hey, he's probably on dialysis. We get to put that Z99.2. Chandra, did you want to add something on there? Because I went through that pretty fast.
I do. I just didn't want you to close this before I could come in and add some information. People are really excited that you covered this in the chat, Alicia. This is,
good.
People that are studying for their CPC and their COC are going, hey, this makes this come together for me from a diagnosis standpoint, not just for risk adjustment, which is great.
Right. That's right.
I will point out all of the answers that we went through here is in ICD-10. For the pre-employment exam that we developed, we give you an answer key for both I-9 and for I-10. So depending on which employers you're looking at. Somebody else asked, well, what are most employers using? Many employers are testing you on both right now. It just because they're wrapping up I-9 and starting I-10, and last year was a mix, so they're actually testing on both. But what I wanted to go back to here was two things. One, somebody asked, well, if you're using N18.6, the end-stage renal disease, and we know by definition that they have to be on dialysis to use that code, right?
Right.
Why do I need the Z99.2? Am I okay to go with this one?
Yeah, go ahead. I was like, that's a good question. Good question.
That's a great question. Well, most people would say because the tabular tells you have to under N18.6, right? It says you need that code, so you better put it on there.
Yeah,
well,
right
actually,
there. Use additional code.
If you can scroll up, Alicia, to where you have the Z99.2 and it lists those excludes notes, this is where I'm going to explain why we have to have that code. So we use the N18.6 to say that the patient has end-stage renal disease, or they have stage 5 kidney disease requiring dialysis. It means if they don't have dialysis, things are going to go from bad to worse pretty quickly.
Did you want the N code or the Z code?
I want this right here where you have it.
Oh, okay. Okay, got it.
I'm just reminding them, right? This code comes into use with the N18.6. So you have N18.6 to say they have the end-stage renal disease. Then you have the Z99.2 to say they're dependent on renal dialysis. Well, if you'll notice under the excludes one notes, there's actually two exceptions where this code would not be the appropriate one to use with N18.6. And it was funny because somebody asked this question really early in the chat before we ever got to this question today. So I was excited about this. If the patient is coming in for that fitting and adjustment of their catheter, yeah, they may be dependent on renal dialysis, but that's not why you're seeing them today. And that's not related to the N18.6. Instead, today, yeah, they still have end-stage renal disease. We need that N18.6. But instead, we want to code first. The whole reason they're here is for us to pay attention to that dialysis catheter. We've got to change something with it. We've got to fit it. We've got to adjust it. We've got to move something. Something's not working right. So that's where we would use this in front of the N18.6, and the Z99.2 wouldn't be on there at all because they're not just dependent on it. They're not just coming in for dialysis. We had to do something. The non-compliance code, the Z91.15, is another code that we could use in combination with N18.6 because N18.6 says they have end-stage renal disease or stage 5 kidney disease requiring dialysis. But if they're not doing the dialysis, we wouldn't want to use Z99.2. They're not complying with what they need, and instead we would use the Z91.15 to say, oh, they need it, but they're not having it done. And that flags a number of things with the insurance carrier.
Right.
Is there anything I left out there?
No, but that is an interesting thing to just know as far as the disease process too. One thing is that in our student call last night, we had a scenario with the HIV patient who was an N18.4 or 5, I can't remember, but he had a fistula, AV fistula, but he hadn't started dialysis yet. So you don't get tripped up just because they have a fistula, and it stated twice in the documentation that he had not started dialysis and that they were wanting him to. Okay, that's, you know, so you can't use Z99.2. He hasn't started it. And then on the disease process side, non-compliance with renal dialysis, I've had patients as well as encounters where the people have decided to stop dialysis, for various reasons. It's not an easy thing to do. And usually when they've been on dialysis and they choose to stop dialysis, we're talking 5 to 7 days left for them. But it's pertinent that would be considered non-compliance with renal dialysis. They're not status Z9 9.2 anymore. They're now a Z9 1.15. So again, that, and like Chandra said, that changes the payer perspective, that changes a lot of scenarios. So you want to be very careful to pick up on the documentation. And again, this overall, and us explaining this and these little nuances, that really is what makes the person who is a coder, I think, really go into that next advanced level to where they're starting to specialize in something. You need to be aware of these little nuances. That's what makes you a great coder.
The only other thing I want to say is somebody in the chat asked, okay, I understand all of that, but Z49.01, which is one of the encounter for fitting and adjustment of a catheter, it's specifically for extracorporeal dialysis. So, well, why would they not code that with the dependence on renal dialysis? And the answer to that is because that Z49.01, by definition, you're not going to have a dialysis catheter if you're not on dialysis. Right? It's not the same thing as an AV fistula. This is, we're cleaning the actual catheter that they have. So there's no need. The Z99.2 in that case would be redundant. It's kind of already included or bundled into that encounter for fitting and adjustment.
And that gets confusing, especially when you're new to coding. It's like, well, some stuff seems redundant. Why are you making me code it? And then other times it's like, well, how do I know it's bundled in? And again, part of that ends up because you understand the disease process, understand why they would do that. Why do they need those two codes to explain it versus with this one code it explains everything. And so that comes with practice and understanding the disease process. Just keep in mind too, there's more than one type of dialysis. And so just as you go and you do your studying about dialysis, if you're not familiar with how it's done, one is they go through the arm, another one, they do it into the abdomen. So little heads up, do some investigating and increase your knowledge base on that.
Do you need more medical certification training? Go to www.cco.us. And don't forget to subscribe to our YouTube channel for updates.